Good afternoon, everyone, and welcome to today's press briefing on the coronavirus. I'm Donna Bush. Glad you could join us via our channels as well as on Radio Cayman. For today's prayer, we go to Pastor Gail Woods.
Our Heavenly Father, we humbly come into your presence, grateful for your love, your kindness, your protection, and your provision. You've been especially good to us in the Cayman Islands, keeping your protecting shield over our nations during this time of pandemic. And we appreciate what our government has done to try to protect the people from this ravaging virus. But Lord, we know that ultimately all of the credit, all of the honor goes to you. You're the one who gives our leaders wisdom. You're the one who protects our people from infection. You alone deserve the glory for what has been done in our islands. I boldly come into your presence on behalf of our government leaders and the people of this nation. I ask that you would continue to give our leaders wisdom, strength of character, and a determination to not make any decisions that would be displeasing to you. Guide them as they guide the people of this nation. Lord, I ask that you give the people of our nation patience and understanding and a willingness to be led. Help that as a nation we would work together for the betterment of all. Help that we would show love and compassion and kindness to our fellow man, even though we are all going through a difficult time. We're trusting you in faith, believing that you're going to continue to help us throughout the remaining days of this pandemic. And so in complete submission, we bring these petitions to you in the majestic name of our Lord and Savior, Jesus Christ.
And thank you, Pastor Woods. Now let's welcome our panelists, His Excellency the Governor, the Honourable Premier, as well as the Honourable Minister of Health. With us in studio are the Chief Medical Officer, the Director of HMCI, and the Sign Language Interpreter. Joining us by Zoom are the Medical Officer of Health, as well as members of the media. We first go to Dr. John Lee.
Good afternoon. Some of you will know that it was World No Tobacco Day on the 31st of May 2020. In conjunction with that, the WHO released a statement, a scientific brief, in fact, on May the 26th about smoking and the relationship with COVID disease. Unfortunately, smoking is associated with an increased severity of disease and death in hospitalized COVID-19 patients. So, as per the previous recommendations, if you can at all use this opportunity to consider giving up smoking, giving up tobacco, that will do yourself a lot of good and stand you in good stead to face any adversity that life will throw at you. The report does recognize that more population-based studies are needed because these are relatively preliminary reports so far. Some of you will be aware that there was an article on diving, scuba diving, in the Cayman Compass. It could well have been an article on a lot of different activities which there are currently restrictions on. I just thought it might be useful to give you a little bit more explanation about how these decisions are made. As with all government guidance on public health matters, we use a variety of sources in order to form an opinion and provide that to the government to aid them to make their decisions. It might be from scientific literature, it might be from expert opinion from major public health organizations around the world, it might be from a specialist industry or an interest group, such as the Divers Alert Network, and also it may well be from local medical opinion, and there are a number of groups that help to advise the process going forward to developing government guidance and advice. I seem to have said no an awful lot of times in 2020. And I'm sure all of you will know how much easier it is to say yes. It's even more difficult to say no when you're taking a view that's different to articulate and rational people. But I have to explain that we have to, on balance, public health, when we're giving advice, think of the good of the public as a whole and as a community rather than at an individual basis. I do recognize that people using scuba diving equipment, which is their own, is probably offers no risk, provided you're following all the other recommendations related to social distancing and so on. So I will be making a recommendation that when the next change in regulations happens, that scuba diving for people using their own equipment is permissible. Just to say that Cayman is not business as usual at the moment. It really isn't. We are waiting to see the results of our unlock. That needs time for us to watch what happens. So please, let us not run before we can walk. There is going to be a new norm. We are still only at level 3 of moving towards level 1, and that's going to take some weeks. Please be patient with this. I mentioned to you yesterday in the written media, you'll have seen it, and possibly on the radio, but through a press release yesterday, that we had a positive yesterday who had symptoms. That positive was, in fact, a child, aged 9 years old, who presented to doctors with symptoms which could well have been related to COVID, and that child also tested positive for COVID. I feel that's a very sobering thought for us all. It certainly shook a lot of us and just reminded us that the disease is still there in the community, and we really need to be on our toes. If you have symptoms, if you know somebody that has symptoms, isolate yourself, and please then present yourself to your local doctor or to the call the flu clinic for advice, or go, flu hotline for advice, or go to the flu clinic, provided you warn them that you're attending. Today I have 59 results to report. Obviously we had a lot yesterday, and I have no doubt that they will flood in as the afternoon progresses, because once this, the way that the labs work, the results begin to flood in from about 2 o'clock onwards and keep going until about 9, 10, sometimes even later. I do know that the HSA had a problem with one of their runs overnight, which is why that didn't get to completion, and so it has had to be rerun, which is why we don't have more. But it does bring the total number of tested for COVID-19 to 12,003. The total positive is thus 151. The number of symptomatic is that one child that I mentioned. The number of asymptomatic at 72 and recovered at 77. There are 59 persons in government facilities, isolation facilities, and 270 people in self-isolation. The patients seen at the flu clinic yesterday were 6, and calls to the flu hotline were 25, although a lot of those were not related to flu symptoms. It was seeking information on how to obtain results and so on. Thank you, Donna.
Okay, thank you very much, Dr. Lee. We're going to go straight to the panel, actually, and then come back for any questions from the media for you, Dr. Lee. So we're going to start with our Honorable Premier.
Thank you, Donna. Hello, everyone. As Dr. Lee has just pointed out, we have now tested more than 12,000 persons in the Cayman Islands, with our testing program leading the region. And whilst the number of positive cases do not unduly alarm us, the fact that we continue to find the virus in our population is an indication that we cannot be complacent. We are still in the suppression phase, and we need to remain cautious. Dr. Lee also pointed out that one of the cases presenting recently resulting in a positive test is a child. I think this is very important, and as he said, sobering, because we are now, I am personally receiving a number of requests from persons and institutions to allow schools, some schools, to reopen and to allow childcare, institutionalized childcare, to resume. As we pointed out from the very beginning, children are the single biggest or vector of the disease, because generally they are asymptomatic, and because it is very difficult to teach children to fight against the natural human instinct to touch and to embrace and to be close to each other. And so while I know the overall results are incredibly encouraging, and all of us, myself, principal among them, are increasingly optimistic that we are going to see the end of this virus in relatively short order. We are not there by any means just yet. And we have, I believe, to continue on the carefully thought out and considered plan that we have for the reopening of the economy, doing it slowly and cautiously, pausing for 2-week periods to be able to assess whether or not the infection rate has increased, and if so, in which particular demographic. Yesterday, we continued our phased approach to reopening, and despite some challenges, I am happy to report things are going well. Curfew time has provided more than 300 letters, exemption letters to retailers, realtors, and construction companies to date, and are geared up to continue responding to requests. So with commerce opening up more, I'm sure this is a welcome relief to many. But please remember that we must continue to practice social distancing, including wearing face coverings or masks while in public spaces where we are not able to properly distance ourselves from each other on a consistent basis. This is particularly so in the stores and in the banks and the like. As I said, I know there are some business sectors that are eager to restart as well, and some have expressed bitter disappointment that they are not yet permitted. This is particularly so within what I will call the touch services, the salons, the hairdressers, and the like, and indeed even doctors' offices, except for urgent or emergency care. But again, while we understand the frustration and the desire to get back into business, we are doing the very best we can and continuing to heed the medical advice, public health advice that we get regarding these sectors and the numbers of persons that we can safely allow back into circulation. And I believe by any measure, the strategy that we have that we have employed over the course of these past months has got to be seen to be working. It would be a real mistake, we believe, to alter course at this critical point. So again, I ask for your patience. We will get there, but we need to do so cautiously and safely. Some quick reminders that we are very cognizant of the issues around the international mail. These are not largely of our doing on this end. International mail is brought here by contracted airline services, and that is a big part of the reason why the mail is international mail is simply not coming on a regular basis. We continue to work for a solution to be found. The passport office is to reopen for 2 days a week from the 10th of June for distribution of returned passports from the UK. And I remind everyone that the fish market is open, as is the farmers market at the cricket grounds. The fish market is now open at the South Terminal. Over the course of many years now, it has been traditional for the Premier to deliver a hurricane message at the start of the hurricane season, which commenced yesterday officially. I've decided to change what is normally a recorded message, which is then rebroadcast, and to simply do it at this press conference because the experts tell me many more people watch this than watch anything else. So here goes. Sometimes I feel like all we've been doing this year is moving from one serious event to the next. And now we are into June and the official start of the hurricane season. We are told this year's Atlantic hurricane season is likely to be extremely active. So I make my usual plea to you to make sure your hurricane supplies are stocked up, that you have a plan for your family and business, and that you stay safe. But my usual plea goes a bit further this year, because we still have to be concerned about the impact of COVID-19. And I know that there are many people out there right now who are out of work. So just getting the necessary 3 to 5 days of non-perishable food, water, and perhaps plywood for shuttering may be difficult. Government is keenly aware these are very challenging times, and we will continue to assist where we can. Government's National Emergency Operations Center is working to ensure that appropriate social distancing protocols are in place in all emergency shelters and that there will be stocks of masks and personal protective equipment available for everyone. We're also aware that normal evacuation options are not readily available, so that will likely result in additional demand for shelter spaces. Social distancing measures also reduce available shelter space, so we have been actively seeking additional shelter capacity. Additional shelter buildings have been identified and are currently being assessed for suitability. We plan to update the list of approved shelters in a few weeks. If you do plan to go to a shelter, please do take masks, sanitizers, and a stock of food and water, but you won't be turned away if you don't have these supplies. While shelters are available if needed in the event of a storm, given the shortage of shelter space and the need for social distancing, we ask that you also consider any other sheltering options that may be available to you. For example, going to strong elevated structures of friends or family members, or to resilient office buildings if those options are available. The extended activation of the National Emergency Operations Center in our response to the coronavirus pandemic has in some respects created an environment where we are as ready as we have ever been for any threat we face, including a hurricane. Here in the Cayman Islands, we know we can weather storms. We have a long history of doing so. We are a strong and resilient people, and we are at our best when we're helping one another during a difficult time. Also, we are blessed that we have a national weather service that is linked regionally and can stay on top of all weather issues and inform us well in advance when bad weather is headed our way. Those warnings give us ample time to make preparations. But I ask you not to wait to prepare. If we do find ourselves facing another storm this year, I beg you to please pay attention to government announcements and bulletins. All of our media outlets, Radio Cayman FM 89.9, The Breeze FM 105.3, Cayman Islands Government TV, Cayman Islands Government Information Services, and www.caymanprepared.ky will carry information to tell you what to expect and what to do. Hazard Management Cayman Islands also works with private media houses that have been diligent each time we have faced a storm to get out the important necessary information. The memories of Hurricanes Ivan and Paloma still weigh heavily on the mind, as do those of the major earthquake we experienced in January this year. All of these events taught us all the importance of being prepared and having a plan. So most of all, please make sure you are prepared. Have a plan, and join me in my prayer that God will once again spare our three beloved islands this 2020 hurricane season.
Thank you, Premier McLaughlin. Your Excellency.
Yes, okay, thank you. Thank you very much. Good afternoon, everyone. It's nice to be back with you. So that's over 850 results over the last couple of days, but of course 10 positives in total. I mean, it isn't huge cause for alarm, and they are largely isolated cases from our screening programs, and almost all of them are symptomatic, apart from the child, which is a significant development, as has been said. I think we had hoped to be seeing far fewer sort of positive cases at this point, but it just leads us to confirm that we must not let our guard down, that there is isolated community transmission out there. And even despite that, many people do ask us to lift the restrictions faster. But I do believe we just need to hold our nerve. Our gradual, phased approach is the right one. And actually, I think one of the strengths of the response in the Cayman Islands has been the united front of everybody on this panel working very closely with our Chief Medical Officer. There's lots of discussion going on behind the scenes, but we're all united in the approach that we're taking. So a reminder again that even though the virus does look quite weak in many ways, we all absolutely have to keep going with social distancing, basic hygiene, and the wearing of masks, and that will continue to be fundamental to being able to live with this virus as we open up more and more of the local economy. So thank you again for all your cooperation. Just on hurricane season, just to associate myself very closely with what the Premier has just said. I will say more on this on Friday, but just a reminder that we have the two Royal Navy ships, Medway and Argus, coming offshore from the beginning of next week for 2 weeks and providing helicopter cover whilst our police helicopter is in the US. And again, that's an important part of getting ready for hurricane season, but I'll say more on that on Friday. And just a few announcements about evacuation flights. I mean, first of all, delighted that we are able to agree the first evacuation flight to Jamaica, and we hope that more flights will follow. And anyone who wishes to come back to Cayman from Jamaica on Thursday is being contacted today. There are a small number of people who will come back on that flight. So the Jamaican consulate are leading on arrangements for Jamaicans here who want to go back to Jamaica. We're all good to go for the BA flight to London Heathrow on the 12th of June. It's fully booked already. The tickets sold out very quickly for that. If you are interested in future travel to or via the UK, please, as normal, register with the travel helpline. My office is also working hard to finalise arrangements for 2 flights to India. One is to Chennai and one is to Delhi, and we hope to announce flights for those soon. And Cayman Airways have asked me to say that there is still some availability for the flight to Miami on Friday, but all the other flights to Miami for the rest of June are fully sold out. And then finally, on evacuation flights, I just want to underline that my office remains very closely focused on the negotiation with foreign governments for the flights. But my office is not in charge of the isolation facility or the policy on returnees, which sits with the government. So the address for queries on the isolation facilities and returning to Cayman is neoc, N-E-O-C, @gov.ky. So just thought it's important to point that out. And then finally from me, just a shout out. This is a really nice shout out to three 12-year-old students at Cayman Prep and High School, Jake Fagan, Zach Brooks and Ben Koch, who are embarking on a Kite for COVID fundraising campaign to raise funds for Cayman's ARC, Acts of Random Kindness. And ARC are contributing $10,000 of food vouchers every week and providing over 1,800 meals per day to our community. And the boys will each be kite surfing 22 miles, which is the equivalent of the length of the Cayman Islands. They've already raised $12,000 and they're aiming to double that amount. So I think this is a wonderful initiative and let's all support them. You can do so via ARC's website or ARC's Facebook page. And thank you to those young gentlemen for a wonderful contribution to our community. Thank you.
Your Excellency. Minister of Health.
Thank you, Donna. Good afternoon, everyone. Grand Cayman, Cayman Brac, Little Cayman, and Caymanian diaspora listening in. Today's scriptures reading is from John 14:12-14. Very truly, I tell you, whoever believes in me will do the works I have been doing, and they will do even greater things than these, because I am going to the Father. Will do whatever you ask in my name, so that the Father may be glorified in the Son. You may ask me for anything in my name, and I will do it. Shout out today goes to Tuca Restaurant. Thank you, Mr. Frank Conley, for advising us of their good work, where they gave out lunch to Gun Bay, Colliers Bluff, and East End for 5 Sundays straight now, over 300 lunches. Thank you to Tuca Restaurant. Also wanted to advise everyone, Reverend Stan McMiles wants everyone to know that Church of God West Bay Soup Kitchen is open on Tuesdays and Fridays from 11:30 a.m. to 1:30 p.m. It's at 388 Town Hall Road, can call 926-2431. Also, wanted to give a shout out to happy birthday wishes to Kim Marshall, your cousin Rhonda. Happy birthday to Denise Parkinson and Ansel Tempra. I understand you're big fans of this show. Happy birthday to you all. This shout out is from Miss Vernal Bird to Premier, Governor, Commissioner, Minister of Health, CMO, Dr. Williams, Dr. Cummins, all government officials, doctors and nurses and frontline staff. May God continue to give you all wisdom, knowledge, and understanding to carry out your duties. And this is from many people in Bodden Town. She also requested a song to go along with this, which was On the Wings of a Dove. How sweet of you, Miss Vernal. Thank you for those wishes. Also, we heard the Premier earlier, and we heard Dr. Lee. Very concerning about the children. And reminds us we have to protect our children at all costs. And that is our future. And we can't destroy our future. So I thank everyone for all that you've been doing for this country to help keep us safe. And there's a lot of people that have been doing stuff. And we all can make a difference. And if you think you're too small to make a difference, try sleeping with a mosquito in the room, says the Dalai Lama. As we move to the next stage of our COVID-19 response, moving to re-enter to the workplace and reopen the economy, we are seeking the support of the business community and the public. We need your help. We need this to be an entire community effort. It is imperative that we all understand that we will not be able to slightly jump right back into life as it was before COVID-19. As we see more businesses open up this week, I thought it was important to share a bit of an eye-opening article with you that I read last month and shared with my strategic team as well. The article detailed the group known formerly as the First Movers, which is being led by Austria and is comparing notes on the response of the pandemic. Other countries involved include Greece, Denmark, and Czech Republic, Singapore, Israel, Norway, and New Zealand. New Zealand, being a country I've heard the Premier praise for its fast, disciplined, and life-saving resolve to do the right thing by its people. The leaders of these countries have swapped notes and experiences on the need to reopen economies safely, including schools, how to manage localized outbreaks, the importance of rigorous tracing and testing, keeping supply chains open, and scientific cooperation, all of which can be reassured to the public the government of the Cayman Islands is doing as well. Austria, who has succeeded in suppressing the coronavirus with just 493 active cases as of this morning, is the latest member to be invited into the group this week. Overall, to date, there are 7,221 coronavirus infections reported in Australia, which has a population of 25,499,884 in its 2020 census. This equals to a very minute figure. To date, they have only 102 deaths. Around the world, there have been over 6 million confirmed infections and more than 300,000 confirmed deaths. This fatality rate has been compared to other deadly events, and in America, the projections have been said to be as deadly and in some cases deadlier than some of the worst battles in the U.S. history. With that perspective, it is a blessing to be able to say that in the Cayman Islands, we have had no community-acquired deaths. This is a wonderful record we intend to keep. However, the next challenge for many other countries, including our own, is how to reopen parts of the economy without prompting a dangerous, the so-called second wave, something parts of Asia are now having to deal with. It is important to note that countries who were once applauded for being a first mover are now also amongst those suffering from second waves. We all want to rebuild, reopen, and restart the economy, but we must not return to a lockdown situation as we have witnessed in other countries, whereby opening too quickly, too soon, caused the second wave of increased numbers of cases and caused more loss of revenue for businesses and government. And even though we want to see families and friends together again, for example, at restaurants and retail stores, or going for staycations, we must remain vigilant. We cannot become complacent. We must follow the guidelines painstakingly put together by our medical experts, policy advisors, and by our cabinet. It has been proven that following the prescribed protocols has been creating healthy communities in our other countries, and we too can remain healthy communities in the Cayman Islands if we work as a team. Going forward, we must accept a new normal, and that includes the continued use of social distancing or physical distancing, mask wearing, proper sneezing and coughing hygiene, proper hand washing hygiene, the use of hand sanitizers, the continued sanitizing of groceries, not only towards of the novel coronavirus, but other possible communicable diseases. As Minister of Health, I'm encouraging business owners or employees to put in place internal company policies which encourage physical distancing of the prescribed 6 feet inside their properties and guidelines that require employees and customers to wash their hands and to cover coughs and sneezes through their masks in any shared space. Employers will need to consider how to manage safely the process of returning employees to the workplace. I dare say it is the responsibility of business owners to take time to educate and train staff of health and safety measures to reopen their businesses. Here are 7 steps to ensure a business follows the government's health and safety measures in the event of the spread of COVID-19. Conduct a risk assessment, employ a health monitoring and safety management system, reduce physical interaction and ensure safe distancing, ensure safe distancing while using shared transportation, provide PPE and encourage good personal hygiene, ensure cleanliness at the workplace premises, perform health checks and implement protocols to manage potential cases. You can find a detailed guidance on the government website at www.gov.ky/coronavirus. I'm urging employers for the health and safety of employees and customers to ensure workspaces are routinely sanitized and to continue using video chats or other technological advances that have made it easier to meet virtually and put less people at risk of contracting the virus. Employers, I'm also asking that the foreseeable future, you can consider in an in-place work-from-home status of any staff who can do so. Once again, all employers will find health and safety measures, guidelines, as well as other resources for reopening your business on our website at www.gov.ky/coronavirus. In closing, I have some additional shout outs. As many of you know, this past Sunday was World No Tobacco Day, as mentioned earlier. I would like to applaud the work of the Public Health Department for their relentless efforts in offering ongoing anti-smoking intervention and support programs to the residents of the Cayman Islands. The National Drug Council for their close collaboration with the at-risk youth in our schools across the islands, educating them on substance abuse. The Cayman Islands Cancer Society and the Cayman Heart Fund for all the work in the community through education and public outreach in tobacco smoking. Finally, I encourage everyone, youth and adults alike, to become educated, increase your awareness of the dangers of smoking, share your knowledge, and let's create a tobacco-free generation. Please stay safe out there. God bless. Thank you.
Thank you very much, Minister of Health. We're going to go now to Reshma from the Cayman Compass with the first question for Dr. Lee, and then we'll go back to the panel after various questions. Reshma, please go ahead.
Thank you, Donna. Good afternoon, Dr. Lee. Just a couple of quick clarification questions for you in relation to your...
Reshma, I'm sorry. Can Dr. Lee say something first?
Oh, sure.
I do apologize for interrupting, Reshma. If I just make a quick statement, that'd be helpful. I forgot to give you the figure that everybody was waiting for today, which was how many positives there are. So of that 59, there was one positive, an assumed community-acquired case. I thought I might also take the opportunity to say that overall, we have had 7 children who have been positive for COVID-19 during this episode. And also to say that at the moment, when you may sometimes see public health going out into the community, they do so when they are screening for people and when they're collecting samples as part of the screening program and collecting samples as part of the contact tracing. So that's often the case when you're seeing people in the community. It doesn't necessarily mean that they're going to a house where somebody is suffering with COVID. They could just be collecting the data that we need to have in order to keep the community safe by outreaching our screening program and also doing our contact tracing. Sorry, Reshma, thank you.
No problem, Dr. Lee. Thank you for that. It eliminates some of the questions that I had to ask. Just on the 9-year-old that you announced today, is that the positive case from today? Because yesterday, when you released your report, you indicated that there was one case that was asymptomatic in that total. So is it the same case?
Not asymptomatic.
I'm a little bit confused. Yesterday, there was a case that was reported that was positive, that was the child, as well as the other positives that were reported. And that child is symptomatic, has symptoms, and continues to have some symptoms.
Okay, so this is a second child you're reporting today?
No, I haven't reported a child today. I beg your pardon. I was just letting you know about the details from yesterday's report, so giving you a little bit more facts on that.
Okay, great. Thank you. That makes it a whole lot clearer. Now, you said this is a community transmission, right? This child, is it the youngest case that we have on island of the 7 children that you've shared?
I'd need to check with public health the ranges of the ages that we have reported.
Okay. Now, since we're talking about children in general, we've gotten a lot of messages from parents who are concerned about the mental health of their own children who are going through this 11 weeks of lockdown with the entire country. From your own medical perspective, is there any advice or any sort of guidance that you can give to parents who are dealing with children who may be experiencing mental health challenges in coping with the lockdown?
I think this is something that's, affecting children right across the world because a lot of them are being basically having to entertain very unusual circumstances, and it's very difficult for the families as well as obviously for the children. We really look forward to a time when we can let the kids go out to play and be together again, and we are actively making plans for that. We've also been in discussion with perhaps having a mental health symposium similar to the clinical symposium that we had a few weeks ago with the doctors, but really with regards mental health and also with a focus on the children. And that's something that I've started discussions about as something that might help people experientially and also perhaps to get some professional guidance about that. So I'll come back to you with that in due course.
Okay, thank you very much. Now, my questions are to the panel, but I believe that Wendy has a question for Dr. Lee, so I'll just let her ask a question and then...
Thanks, Reshma. We'll come back to you in just a few minutes. Wendy, please go ahead for questions for Dr. Lee.
Thanks, Donna. Can I just clarify, Dr. Lee, the child, when you say it's symptomatic, has the child been admitted or is it just minor symptoms?
The child was not admitted, merely treated as an outpatient basis, but at the time, many people passing through healthcare, if there's any possible suggestion that they may be COVID-related, they'll automatically get swabbed. So that was, in some senses, a routine swab, although, especially in children, you can present with the somewhat atypical, not necessarily the same symptoms. So the doctor's guard is always up very, they're on notice about checking to see if anybody might be presenting in an odd way.
And that child was not a contact of its parents, for example, that were positive or has come back in and has been in quarantine or anything like that? It's just a random one child in a family.
Yes, I don't have. We're still collecting the information, so I don't know. Clearly, that's an interesting thing to let you know, and I haven't got more details for you at the moment.
Okay.
We will have those
'cause
details,
obviously-
but it wasn't a traveller, no.
Okay, because obviously people are going to be interested as to how a child would acquire it when,
Yep.
Especially if their parents don't turn out to be positive either.
Yeah. I think we're all very interested.
given-
We're all very interested in that, and
Okay.
I'm really keen to find out myself too. So.
Can I just also check, of the other 7 children that you say that have contracted the virus, have any of those been symptomatic at all?
Some have had
Oh, sorry,
mild. Some have had mild symptoms. I know of at least one family where that's been the case, but I'd need to look at the details of the cases to give you more on that. I don't have it to hand.
Okay, but as far as you're aware, none of them were serious.
No, none of them were serious.
Okay.
And
is the status-
when a doctor says serious, they mean would need to
Hospital.
be admitted to hospital. Yes.
Yeah. Okay. Also, is the status still the same on all of the other cases that we have? That there is no admissions in the hospital and nobody is critically ill or very ill?
That is correct. We only have the one symptomatic person, and there are no admissions.
Okay. So when you say there's just one symptomatic person at the moment,
Yes.
and that's the child?
Yes.
Okay. So everyone else, so all of our active cases are asymptomatic now?
Correct. As I gave out in the figures, 1 symptomatic, 72 asymptomatic, none admitted, 77 recovered.
Okay, great. Just my final question, which is about the blood tests, which I understand are coming now. Can you give us some idea as to what government or what the public health department will be able to do with the results of those tests, seeing how that we still don't know yet how long, if any, immunity is conferred on people by actually contracting the virus? Can you give us an idea of how these blood tests are going to help us?
I think the most important information is for us to know how much penetration of COVID there's been in the community. That will probably enable us to understand whether there's any sense there may be some herd immunity. If we find out that 80% of people are IgG positive, then there's been a huge amount of penetration. If we find out there's only 10 or 15%, then that's more likely as what I think it's probably going to be a smaller percentage of the population. That may well guide our decision as to how relaxed we are about opening up. Because if there's clearly been a huge exposure that we don't know about, then that may make us more relaxed, although I don't think that's going to be the case. So that's in essence what we're looking for. And the only way we can do that is to sample a large proportion of the community. Unfortunately, with this particular test, it will need to be drawn blood. So I'm hoping people will help us with that.
I was going to say, have you got any plans yet as to how you're going to work out who gets tested, or will it be just a straightforward volunteers step forward?
We definitely don't want it to be a step forward, because that will always give you a skewed bunch of people who step forward. What we're going to be doing is we are already liaising with the Economics and Statistics Office for them to provide us with the sample that we will, and we will use that sample to help us to get the people to come forward to be tested. However, there will be a proportion of people who we will test in any event who will be the frontline healthcare providers.
Okay, that's all I have. Thank you very much for that, Dr. Lee. Appreciate it.
Thank you.
Dr. Lee, I do have one question before we go back to the panel. The one question relates to the Kim and Brack. Any further tests happening there? If so, how many? Do we have any date?
Dr. Velasamy is normally very good about giving me an update, but I haven't had one today. Okay. I have actually talked to him, but haven't had an update on the exact figures at the moment. I apologize, but I'm sure he'll give one before tomorrow.
Okay,
by Friday.
By Friday, yeah. Okay, thank you very much, Dr. Lee. Are we going to go back to the panel for some further comments?
Yeah, Donna, thank you. Could I just clarify? I think when I made my comments about the BA flight, I said it was sold out. It is sold out from here going to London. It is not sold out coming from London to Cayman. So if there are any Caymanians in London whose blood pressure has just gone up, I apologise, but there are plenty of seats available on that flight coming to Cayman.
Thank you, Your Excellency. Okay, we're going to begin the panelist questions now, starting with Reshma from the Compass. Reshma, please go ahead with panelist questions.
Thank you, Donna. My first question goes to the Premier in relation to the results today. Premier, given the undertaking that we've gotten with the results and the findings that Dr. Lee has shared, does the government feel comfortable in unlocking the economies of Little Cayman and Cayman Brac as Cayman approaches the 30% threshold of testing the population? And by that, I mean expanding the bubble to open up inter-island travel. If not, when do you see that happening?
I've had these discussions with the Deputy Premier as recently as yesterday. And again, we'll be guided, continue to be guided by the medical advice that we receive. But at the moment, what is being contemplated or considered is simply expanding the bubble to Cayman Brac and Little Cayman. Grand Cayman is not at a place now where I think the Cayman Brackers or Little Caymanians would welcome open borders, because we are still seeing significant numbers of positives come through. And I'm not sure what the percentage is, but I figure we must be at about 18% of the population here. So, but as between Cayman Brac and Little Cayman, Cayman Brac is approaching 50% of its population. We tested, Little Cayman is at 100%. So those discussions will go on over the course of this week, but I see it initially as being Cayman Brac and Little Cayman, allowing travel between those two. I think opening the borders to people from Grand Cayman generally is still some weeks away.
Okay, and would you be contemplating quarantining individuals should you get to that point, or when you get to that point, rather?
What point?
Of opening the inter-island travel. Would they have to be quarantined when you open inter-island travel?
Between Cayman Brac and Little Cayman?
When you open Grand Cayman to allow free travel in the coming weeks, as you said, would that require any level of quarantine for those who are going from Grand Cayman to the smaller sister islands?
No, that's what we have in place now. There is travel between Cayman Brac and Grand Cayman, but anyone who comes here has to quarantine. There's usually people traveling from Cayman Brac to Grand Cayman for funerals or for hospital visits or whatever the case is. They have to be quarantined before they go back. So when we're talking about opening the borders, it would mean the quarantine would be a thing of the past. At the moment, there can be limited and is limited travel between the islands, but anyone who is going back has to go back in a sanitized state, to put it that way. So they have to be quarantined for 14 days and travel directly from the isolation facility to the plane and back to the Brac or Little Cayman, as the case may be.
Okay, understood. I'm just curious, does the government have a population estimate that it's working with at this point in time, any population numbers in relation to Cayman's overall estimate? Is that something that is available? And what is that figure?
No, I don't think an official exercise is done. I think we've done some basic arithmetic. We know how many people have gone back on evacuation flights. I think we have the numbers for how many people would have left here in the immediate weeks or the weeks immediately before the lockdown. But we do not have an actual estimate, like one carried out by ESO, for instance. I think our guesstimate is somewhere between 64 and 65.
Okay.
But I emphasize a guesstimate. It's not something that's based on an actual scientific exercise or survey that's been carried out.
Okay, that brings me to my next question. We did have that planned, a national census planned for October, one that is that has been in the works for some time. Given the protocols that we have and the situation that we are in, and of course the expense that carries, would government still be progressing with the national census in October?
I haven't heard word otherwise. October is still a ways away, and the way that things are evolving around this epidemic are now moving pretty quickly and in a very positive way, although there remain concerns in many quarters about a possible second wave in September. We hope to have insulated Cayman from that possibility. We never had a first wave to start with. As Dr. Lee has put it, we had a ripple, and we're doing everything we can to avoid that happening here. But assuming things are or continue on the present trajectory, I wouldn't see any reason why we couldn't proceed with a census in October. In logistical terms, whether we want to do it then, given the rather artificial state, if I may put it that way, that we'd be in with borders closed, is another matter. But those sort of issues haven't been pushed up to the caucus of the cabinet yet as to what the people who are the officials involved are thinking.
Okay, great. Thank you for that. My next question goes to the governor in relation to the BA flight. We've had some passengers reach out asking if there is any consideration to allowing additional luggage on the flight. They've been informed that only one piece of luggage is allowed. Is there any guidance that you could provide for them? Any advice that you can provide for those who are basically packing up their lives and heading to the UK, or for those returning to the UK for school or whatever the case may be?
I mean, I haven't got those details to hand, Reshma, but I'll take that away, and we'll put something out, or probably on social media after this press conference on that.
Okay, great, thank you. And just staying with the evacuation flights, is there a specific criteria that is being used, or for people who are seeking to get on these flights? For example, are there any fact-checking, cross-checking to ensure that these flights are being used for evacuation flights and not for possible leisure trips for people who may come back and then quarantine government facilities? It's a concern that has been raised by a couple of members of the public to me. So can you tell us that process will go on to these flights?
I mean, I think people's reasons for travelling, it's a wide range of different reasons. There is clearly a great number who are leaving the islands, but there are some who at some point will have to come back. But that remains challenging because of the need to isolate and the availability of space in the facilities. But we have simply used the details that have been placed on the travel helpline. Everyone who's wanted to travel has had to register there. So the people who have registered there are the ones that are going on the flights.
Okay, thank you. Now, a couple of students from the US have reached out who are here on island, expressing concerns about their ability to get back to the US for the sake of gathering their personal belongings because of the situation with the schools there, the rioting, those various things that are happening in the States. And they've reached out and asked if there's any special provisions that is going to be made for students in particular who would need to do that sort of exercise, getting back to school, preparing or packing up and coming back to Cayman. Would that be something that is being contemplated by government?
I don't think there are plans to make special provisions for that situation. I understand that that's difficult and challenging, but there are regular flights to Miami, and people are advised to go to Miami and then go on from Miami to other destinations. Then if people need to come back, the policy at the moment is that they would need to self-isolate for 2 weeks in the government facility. So that's the position as it is today.
Okay, thank you. My final question, I don't know if Premier would be able to answer this, but I'm going to ask it anyway. CXC has issued its timetable for exams starting July 13th. Would you be in a position to update students on what the process is going to look like for them? The social distancing, those are some of the concerns that are being raised in relation to them writing exams?
Okay.
Sorry to put you on the spot.
No, you haven't put me on the spot. You know me. If I don't know the answer, I'll tell you I don't know the answer. I saw Dr. Lee.
We're not laughing.
Dr. Lee
at
moving
volunteering.
around. I saw Dr. Lee moving around there. I thought he was going to volunteer, but apparently not. But no, I don't have those details at all. But I can ensure that we get them and that gets put out. I'll ask the Minister of Education to get on that and ensure that the department gets that information out there ASAP.
Okay, great. Thank you very much.
Okay, thank you, Reshma. Dr. Lee, you have to say?
Hi, I just wanted to give an update on the figures about the children, just as it's pertinent and current. That 3 of the 7 children, including the child that we're talking about from yesterday, have had symptoms relating to COVID. So 3 of the 7. Thanks. Thanks, Tom.
Thank you very much, Dr. Lee. Okay, we're going to go now to CNS, to Wendy. Wendy, please go ahead.
Thanks very much, Donna. My first question actually is for the governor about the Jamaica flight. Does he have any numbers on how many people are anticipated to be leaving on that flight?
I don't have an exact number, Wendy, and all those arrangements are being handled by the Jamaican consulate here, so it's not really for us to say. I think you'd need to contact the Jamaican consulate on that. I mean, it will be bringing back a number of Caymanians from Jamaica. I think that's sort of 20 to 30. But you'd have to speak to the Jamaican consulate on the outward people.
I appreciate you're not involved now, so you might not be able to answer this one either. But do you have an inclination that there's likely to be more flights now that Jamaica have opened up the borders?
We certainly hope so, and I think that is our expectation moving forward. And we're certainly very aware there are a lot more people who would like to depart. So we'll certainly be doing everything we can to make that happen.
Okay, thank you very much, Governor. And for the Premier, the first one really is just, is there any central place or a particular link or website other than the formal regulations that outlines what's currently allowed now and what isn't? Because there does seem to be a little bit of confusion over the latest changes, as well as the changes coming up on the 7th. I think there's been some people are already thinking that what's going to happen on the 7th is already allowed now, and various, we've had people saying that on Cayman Brac, people are diving, and here in Grand Cayman, people are now sailing. So there's too many questions about what is and isn't allowed to ask at these briefings. So I just wondered, is there a central place that we can direct people to get these questions answered?
Yes, all of the information is there in stark terms on the website. It is easy to access. It's easy to read. But a lot of people are, I think, being a bit, shall I say, aspirational about what they think ought to be allowed and what not to be allowed.
Yeah.
I've actually put out my own notes, which are in wide circulation as well, and those are up on the Office of the Premier's website. But I keep getting the questions too, Wendy, so I know what you mean.
Yeah, I was just wondering if there was whether it's where it is, because is it on the coronavirus, on the Explore Gov website, where it says exactly what businesses are open and what you can do and what you can't do?
Well, it doesn't say what businesses are open. It says what type of businesses.
Yeah.
Yes.
That's what I meant. Yeah.
Yes, it's there, and as I said, you can go to the Office of the Premier's website as well. It's there. The actual regulations are up there as well as the explanatory notes. And the communication team at JS have been doing an excellent job at putting out their usual communications. It's all over the place. I mean, I get multiple versions of it. Some of the stuff that was published in the media was not entirely accurate, which didn't help at all either. But I fully understand. I mean, this is a moving feast. It's changing all the time, and it's difficult to get it all right. But it's all there if people take the time to go have a look.
Okay. The other question is about the letters. You said earlier that
about what? Sorry.
Had given out about the exemption letters. You said that 300 had been issued. I'm taking that since you introduced the new shelter-in-place order since Friday. So there's been
Right.
300
So
letters
that's
since Friday.
construction and retail and realtors. Yeah.
Okay. Can you give us an idea of how many people have actually asked for it? Because we're getting so many saying that they're still waiting on letters. So I'm guessing the numbers must be quite high. So it'd be a good idea to put that out there so people understand why they might have to wait a day or two.
Well, since the regs only came into effect yesterday, I think that's not a pretty bad record, but I don't actually know how many applications.
No, that's what I'm saying. So do you know what the number of applications are that have been, the number of people that have come forward and said, I want a letter, I want a letter?
No, I don't. I don't. So you remember now that we opened part of construction last week. So this is the other, or 2 weeks ago, I've forgotten now, but yeah, 2 weeks ago. So this is the other bit of construction, 2 weeks ago. So this is the other bit of construction now with with retail and the realtors added to it. But it all seems to be going pretty well. I mean, I think I have a pretty good feel for it because I get hundreds of messages a day, and so I kind of weigh how well or not we're doing based on the number of complaints I receive in any given day.
But it's safe to say that you probably had hundreds more requests that you've got to deal with.
I don't want to speculate.
Okay.
When I just don't know. I only know what I was given when I came in this morning. And they gave me the actual numbers of ones. Up until I came here, there were 260 retail and 47 realtors in that number.
Right. Okay. My last question is about the work permit holders who will be returning and what the protocols are around that. Have we sorted, is that actually happening yet? Like, are bosses now allowed to bring new permit holders who have been granted a work permit from overseas and returning work permit holders and to go into quarantine? Are those quarantine facilities available yet? And if not, when will they be available?
Well, it's certainly permitted. I don't have any information about whether people have actually come, but it's certainly permitted. We made the announcement weeks ago. Obviously, if it is someone who already had a work permit, there's no issue, because the work permit would have been granted already. Your question is not about persons applying for work permits at this stage, is it?
No, it's about the quarantine facilities for those that are going to have to pay themselves.
Right. So I don't know if Danny can help with the details on this. I just don't have that level of information. I hate to speculate. The question is, this is for the benefit of Danny. The question is whether or not the isolation facilities for persons who are paying for themselves, who come back, for instance, as work permit holders, are they ready? And if so, to what extent has that facility been utilized?
Thank you very much, Wendy. We are looking right now into increasing the shelter capacity in the isolation facilities. There is obviously some high-level decisions to be made as to what the future of that looks like. But again, the priority has been given to Caymanians and permanent resident holders. But again, most of it comes down to how many people we can get into those facilities, given that obviously that's not an unlimited number of people to get in there. So it's a work in progress, but at the same time, we do appreciate, there's a big cry for people to come back to Cayman, be it work permit holders and Caymanians and permit residents who want to come back, and we're just doing our best to make sure we can give them a room to stay at the inn for the 14, 15 days required, and then the test.
Okay, great. And Danny, thank you very much. I appreciate
Thank you.
Thanks, Danny. When my efficient team at Curfew Time have sent me the information, they're listening keenly. 61 applications are currently outstanding. All will be addressed by the end of the day. As of May the 1st, we've had over 4,000 applications. Requests are considered within 2 business days, with most receiving a response the same day. So they're doing a pretty good job, I think.
Thank you for that. I appreciate it. That's all my questions for today. Thank you.
Okay, Wendy, thank you very much. I have a list of questions, but I'm going to ask one in particular. A member of the public would like to know what serious procedures are in place to ensure that business owners are first employing Caymanians. As I know, that's been a big thing for you, Premier McLaughlin, as well as His Excellency, to employ those persons first, as opposed to bringing back persons on work permits. As Minister McTaggart, we know, predicted a substantial unemployment rate in the foreseeable future. So this person wants to know what serious procedures are in place.
Well, I'm not sure what is meant by serious procedures, but the law sets out what the procedures are. And we've also moved in recent times to the requirement that all job applications have to be posted on the I've even forgot the name of the portal, but that has been set up by work. So everyone can go directly to that. I hope someone is listening on the team that will jog my memory with what the name of the portal is that you have to go to. So I can give that to people now, so they can go there and see what jobs are actually available, because all employers are mandatorily required to advertise there. Obviously, they're free to advertise in the local media as well, or overseas, as has been the case before. But you will be able to see exactly what the jobs are there, and all of these things will continue to be considered, shall I say, with even greater scrutiny now in the particular times that we are in. Because what we don't want are two things. We don't want people here who don't have a job and whose services or skills are not absolutely required. And we don't want people here doing jobs for which Caymanians are willing, able, and qualified to do.
I believe the portal is Jobs Cayman. So if you just go on work.ky, there's a link there for Jobs Cayman.
Jobs Cayman. Okay, I agree.
Thank you.
It's so simple I couldn't remember it.
That's okay. You have a lot on your mind. So
I do.
fine.
Jobs Cayman. I've got it. They're on the ball. Jobscayman.work, WRC, .gov.ky. Jobscayman.wrc.gov.ky. Thank you to my team.
Thank you, Premier McLaughlin. We're going to go now to the Caymanian Times. Ralph is standing by. Ralph, please go ahead.
Good afternoon, Mr. Premier and the panel, and hope you're keeping well and you had a great weekend. I have a few questions for you, but one short one for the governor. I'll just refer to him at first. Governor, can you update us on the Nicaragua situation? Getting those folks back to Nicaragua.
Yeah, no, again, very conscious of the impact of that situation on the Nicaraguans who are here. And I'm afraid there is no change in the decision. But I think we will reach out again to the Nicaraguan government and see when they might be willing to accept a flight. But as of today, there's been no change in the decision of the Nicaraguan government.
Okay, thank you very much. Mr. Premier, back to you. I have two questions. The first one is on the construction industry. We're happy to see that the construction projects are starting again. Do you have an idea of any number of projects that have started, or some of the main projects that have started, and will they be continuing to completion?
Well, I only know anecdotally from driving around. Frankly, I don't have a list at this stage. But what I can say is there is a huge push on the part of developers and contractors, or there was, to get back into the business. And we're seeing that, I think, manifested in the number of applications that we're getting for the letters, and the number of people we're seeing back at work. So I think that things are going to be going gangbusters in another 2 or 3 weeks as more and more companies get back into the swing of things. So there's a great, I think there's great scope and reason for optimism that the development and construction sector of the economy is going to be able to pull us through the difficult months ahead. And as things seem to improve with respect to virus, subject always to this abiding concern about a second wave elsewhere. I am getting more optimistic about us being able to open the borders, sooner than perhaps we had thought. And when I say that, I'm not talking about changing the date in August, which we had agreed, the 31st of August. I frankly, at some of my lower points, I didn't see us reopening until early next year. But I think that unless something strange happens now, so there's so many positive things that are happening with respect to testing, with what seems to be happening with the mutation of the virus and its potency and ease of transmissibility, that we might be able to see a bit of recovery in the tourism industry before the end of the year. Now, I know a number of other countries around the region have attempted and are attempting to reopen. We are looking very carefully at those experiments, and I think they will help to guide some of the decisions that we will need to take in the coming weeks and months.
Thank you very much. Somehow you seem to be reading my mind, because this takes us right into the next question that I'm asking. Before I ask it, just to say that you are right with the popularity of the press briefings. I think the ratings have gone through the roof. The question, we have seen the protests next door in the US, and many of us have great concerns as to what has happened to social distancing. Now, we know that our greatest tourism market comes from the US. Do you think that what is developing over there and the impact it may have on the second wave of coronavirus positive cases in the US, will it impact our ability to open the borders earlier or later?
Well, that is one of the experiments I'm watching very carefully.
2 weeks or no?
Hello, sorry. Yes, when the response.
Okay, that's the response.
That's it. I said that's one of the experiments I'm watching very carefully.
Okay. Have you heard anything on the latest results? Because somehow we are not seeing how America is progressing with the number of cases. Have you seen anything recently since this whole since the whole protest started 7 days ago?
He's asking, have you seen an increase in cases, COVID cases, since the protests and what have you?
Oh, in the U.S.?
Started in the U.S., yes.
In the U.S., yes.
No, they don't seem to be reporting on very much on COVID infection rates at this stage, for obvious reasons. But I think if the theory that the potency of the virus is weakening is more than a theory, we should have pretty good evidence of it in the next couple of weeks, because with the sheer number of people and the number of cities and the closeness with which people are operating, even though I see many of them are wearing masks in the images I see on television, I think we should have a pretty good idea of what's happening there. Obviously, the U.S. administration has taken a particular view about how they manage this epidemic, even if it is a default view, which is, we let it run its course. Yes, there are going to be some tragic deaths. In fact, now well over 100,000. But in the end, we'll wind up with something approaching herd immunity, and then life can get back to normal. So that's always been an option, and that always is an option if you don't value human life the way we do here, and you say, well, let nature take its course and let the strong survive. But that's not the approach we've adopted here, and we don't plan to change course now.
Okay, very well. And the question was related to tourism. Do you think that our data of September 1 will be impacted if the negative results come from this event, where more people start attracting the virus in the States?
Well, I think the obvious answer to that would be yes. I mean, if the infection rates are even higher than they currently are now in the United States, it would be something approaching madness to open our borders and say, after all we've done, all the sacrifices we've made, that we're going to risk having people back, unless there is, and there's always a promise of there is the ability to test people accurately in a relatively short period of time, meaning minutes rather than days and weeks before they actually come here. I mean, you're still taking something of a risk, but especially if you can do the antibody test, then you can presume, I believe, the non-scientist that I am, there would be some level of immunity. And also being able to do the immunity test, antibody test here, we'll be able to have, I think, a better read on the ability of this community to manage that increased risk, because the more of us who have presumably built up some level of immunity to it, the better we would be able as a community to cope with fresh infections.
Thanks. So that's all.
But these are all things we are considering and discussing. We haven't taken any decisions on these things, but we ruminate a lot.
And that's why we tend to phrase the questions the way we do, just to get your feelings and get your thoughts as well as to get your answers. Thank you very much.
Okay, thank you very much, Ralph. Any final comments from members of the panel?
Just, earlier we heard a question about kids' mental health. And I just wanted to say that parents can call the mental health hotline, 1-800-534-6463, which is open 10 a.m. to 6 p.m. Monday through Friday. Parents are advised to keep in touch with the mental health professional if a child is in treatment. This message was from Nurse Dimpna Carden, who's a community mental health nurse. I actually I've been trying now and to get a mental health professional or specialist on the program, and we're working on that so they can be on the press conference. It's kind of a healing of the nation, so hopefully soon.
Okay. Thank you very much, Minister of Health, and thank you to the public for joining us for today's press briefing. Also, of course, to our esteemed panelists for bringing us up to date. A reminder to go online to gov.ky/coronavirus for the latest information. We invite you to join us back here again on Friday. For those watching on television, we leave you now with today's world and regional statistics.